because there's an interesting angle to this. You just mentioned it there. There's a link between breast, prostate and ovarian cancer in the BRCA1 and or other genes which have been discovered. That may mean there's an inherited component, both in males and females. Has that been an issue for you?
Yes, absolutely. Obviously, when I went to see the genetic team, they traced it back through my mother's side. So obviously my mother's father obviously had the gene, then it was passed to my mother, then it was passed to my sister and myself. And because there's a 50% chance of it actually being passed to the next generation, there's obviously a 50% chance of my son having the mutated gene and also my two nieces as well. So it has a lot of implications. Obviously, once you carry the BRCA1 gene as well, you're actually born with an 85% chance of breast cancer and something like a 50 to 60% chance of ovarian cancer throughout your life. So it also raises the question, you know, what happens here? And we've both been advised to have double mastectomies as well, which is a bit of a nightmare. So it's an Angelina Jolie situation, only unfortunately I had to get the cancer before I actually found out that I was BRCA1 mutated.
So this is another angle that's opened up in terms of awareness and also screening, that it's not just for the current illness, you can actually screen for a risk factor.
Absolutely, that's right, yes.
And you think this would be worthwhile adopting in the way we
oh, absolutely. Operate? I mean, I'm probably talking rubbish from a doctor's point of view, but the way I've observed it, I mean, perhaps there might be a possibility of GPs just checking that CA125 once every 6 to 12 months of anybody whose mother has died or sister has died of ovarian cancer or has ovarian cancer. Might just be worth it.
I can see the logic in that.
Yeah. But I mean, I don't know, obviously from a scientific point of view, I mean, I don't know where we stand with that. But if it's all down to money, I'd be very, very angry.